Joe's has a lot to offer to new fellows looking for an infectious disease fellowship program. We have a great mix of clinical cases and people from all socioeconomic walks of life. Being a tertiary care center, I think we get to see a lot of pathology. We have a large variety of surgical infectious diseases. We have a long-term acute care facility on site. We see a number of patients with prosthetic joint infections as we have a large orthopedic center. We do have a lot of HIV patients in our clinic, which we get to see during the training. We have rotations for TB clinic, travel medicine, STD clinic, bone marrow transplant infectious disease, solid organ transplant infectious disease, and pediatric infectious diseases as well. The faculty at St. Joe's is very friendly, very amicable.
In one word, the faculty is awesome. They not only are they so informative of the current evidence-based practices, but really ultimately what really matters the most is that they're accessible.
From day one, they develop a personal relationship with each individual.
The faculty here are so excited about teaching that in the month that they don't have a fellow rounding with them, they express that they really miss having a fellow round with them and miss having someone to teach.
During the didactic sessions, we do discuss all the latest evidence-based articles and all the evidence-based practice, and that is what is being practiced here at St. Joe's.
We have infectious diseases grand rounds. We hold weekly plate rounds where we go into the microbiology lab and actually see cultures, gram stains, plates, etc. And this is a very fun, very popular part of our training program that all the attendings and fellows enjoy.
One thing that's important in your training program is, do we have cutting-edge technology and services available for our patients? And you'll definitely find that our hospital is at the cutting edge.
They have a great SIMS lab where the residents get a lot of exposure about different procedures, including intubations and putting in central lines, PICC lines.
We are using the simulation center to allow our fellows to get more of a look into their patient care experiences.
These machines, this technology, specifically the computer system, we try to incorporate it into our practice so that it kind of aids and not inhibits.
Ann Arbor is a great place to live. It has all the perks of a big city.
Theater, food, music, entertainment. But it's not a big city in the sense of a Chicago or a San Francisco. It's much more accessible, much easier to get around.
The most important thing I like about Ann Arbor is the diverse population. And it's a good university town.
Ann Arbor is a very exciting city to live in. It's diverse, multicultural, very accepting of people across races, across genders.
It's just an infectious, happy, very forward-thinking city that is super attractive.
The infectious disease program here at St. Joe's is a very well-rounded program, and we get to see great pathology.
You are recognized not by your gender, your skin color. You're recognized for the value you bring to the hospital and the value you bring to the program.
The faculty in itself is very receptive, very approachable, and you get to learn a lot from them. In addition, Ann Arbor in itself is a great place to live in and raise your families.
If you are looking for a strong infectious diseases clinical program with a faculty who are passionately committed to teaching infectious diseases, a great variety of clinical cases, all set in the context of a hospital in a multicultural environment, this is a place for you.